our next module, your therapeutic communication. This is in continuation with our module before, your communication skills. Therapeutic communication is necessary in the field of caregiving, for at least you would know how to deal with statements made by your clients during or while you are giving care to him or her. So just like all other modules, we're going to have a grade here, though we don't have any quizzes. We will just extract the 50% from your final exam, and then the 50% would come from your skills. So your skills, anyways, I'm going to give you a task after this discussion also, so that you could be able to make up with your skills requirement. Okay, so why is it necessary to have or to let you learn or at least express yourself to your communication skills? It is very much important that you would know how to talk. That is why I'm going to congratulate every one of you for submitting your requirement in communication skills leading up to now the therapeutic communications. So congratulations, because you know how to speak so well. Actually, speaking, it needs lots of practice. Okay, so the way I speak to you now is not the way I speak to everybody before. So I am very much timid. So I never talk to people. I sometimes talk to people. And of course, your background has a greater weight when it comes to your relationship with others. So before I'm going to start your therapeutic communication skills, because I find it necessary to express myself as well. So I am Irene Lim. For those who doesn't know me, my name is Irene. I was married to my husband, your Cloyd Lim, and then we're married for last 2000 and year 2000, and we are very much together until this point. And of course, I, based on, as what I've said, I don't know how to talk to people before. The way I talk to you now is different from the way I talk to other people before, because of my background. So my family is very much out, or they are not together. So I belong to a broken home family. So that makes sense, because if you belong to one, of course you will be that aloof in dealing with others. Okay, so I do excel academically. So medyo bookworm po ako. I read lots of things, especially when in relation to my course or my profession, nursing. So I graduated way back 1996, I guess. 1996 ba? Oh, 1996. I graduated in nursing in 1996. And I graduated from Misamis University. And so I am a nurse by profession. I got married. And syempre, because of my background, I tried my best to have my family intact. That is why I'm here now. Okay, so, and I already I already achieved the point na I could carry myself so well when it comes to talking. And like before that, because of my background, I have this tendency to hide. Okay, and I don't want everybody to do the same. I know it is normal to hide from others, especially if you are, of course, if you have some past in your back. But make sure you have to develop yourself, just like what I am doing. So developing ourselves is very much important. Okay. Why am I expressing this? Because it is in relation to your therapeutic communication. That therapeutic communication is very much necessary, especially if you're doing or dealing with people like me, or those people who have who are stressed, who have lots of problems, who has this feeling of inadequacy, or in general, who has problems when it comes to, who have not problems, but issues when it comes to their mental health. Okay. So one of the contributory factor, greatest contributory factor for mental health is your family. So since I don't have my family with me, I grew up with my grandmother, that makes sense. Of course, I have some issues when it comes to mental health. But before to siya, that is why I do some coping mechanism. I'm married to my husband, who is very much exactly my opposite. And that's why mo na siya. Okay, so we're going to go to the discussion proper. So again, 50% from your final exam and then 50% from your skills, which we'll be dealing later on. Okay. So for those who are new, I guess maraming bago. I guess congratulations for choosing IHLCTC. Hopefully that you will become satisfied just like others for choosing us as your institution in your chosen field, caregiving. Congratulations, everyone. So, start na ta. So, first is your therapeutic communication. So, the subject is, or the module is therapeutic communication. First thing first, in dealing with therapeutic communication, we're going to define first, as what I've said, it's very much necessary in dealing with people. So we're going to discuss, or we're going to identify what is it. So we have here the mental health. Mental health, from the word mental, diba? It refers to your brain activity or your brain in relation to your behavior, diba? So, is a lifelong process of successful adaptation to a changing environment. The individual is in contact with reality where all factors of life are poured in and experienced by one. So, lifelong process, so forever po siya. It starts from your very stage infancy to the stage wherein you're going to have as your aging. Okay. So, lifelong po siya. So, successful adaptation. So, for example, as what I've said earlier, I belong to a broken family. So, that was my given situation. So, I should adapt to it, di ba? A person should adapt to it so as to maintain his mental health. Because if not, there's a tendency that if you're going to lose, of course, you end up to mental institution. And of course, it is not the only one factor. For example, if you're going to combine it with drugs and all, so basically, for sure, you're going to end up in the mental institution. So the individual is in contact with reality where all factors of life are poured in and experienced by one. So, expose po tayo dun sa mga situations wherein as a given fact that we belong to a broken home, dapat po tayong mag-cope, dapat po tayong mag-adjust. So we're going to deal with adjustment later on. So we have also the term psychiatric illness. As what I've said, if it is not intact, your mental health is not intact, you are going to result to psychiatric illness, or you're going to have it. You are going to have issues with your mental health. You end up a psychiatric patient. So, illness is the loss of the ability to respond to the environment in ways expected by one and the society in general. So, pag hindi mo na balance na yung hindi mo na maintain yung mental health mo po o hindi na po siya balance, you are going to lose your sanity. Okay. So, you will be suffering from psychiatric illness. It is characterized by the thought and behavior pattern that impair functioning and cause individual distress. Remember that. That is what, kung hindi mo na makaya yung mga stress sa life, hindi mo ma-cope, o wala kang hindi, yung mga defense mechanism na gamit nyo po ay hindi masyadong appropriate, so you will end up to having an illness, and that is your psychiatric illness. Characteristics, you have does not accept self or even dislike it. So if you are like that, for example, sabihin mo na, example, ako, nandito ako, so my name is Irene Lim. It is normal that feature yung mga, let's discuss the features. Oh, hindi matangos yung ilong ko. O, di ba? Pag hindi matangos yung ilong ko, pag hindi ko in-accept na hindi matangos yung ilong ko, so definitely, I manifest one of the characteristic which is does not accept self or even dislike it. Just like before, I found out, especially when I became an adolescent, I found out that I am colored brown compared to my brother. May sabi ko, bakit maputi yung brother ko? Ako hindi. Yung nanay ko maputi, ako hindi. Sabi ko ganon. So, I hate the fact that I am not maputi. And later on, if I am going to stop that in my mind, that deficiency of mine, I'm going to keep it bothering me, then I will going to result into your psychiatric illness. Okay. Unrealistic perception of strength and weakness. So there is also one. Mali yung pagtanggap mo sa strength mo at sa weakness niyo po. Okay. So, next is inability to find meaning and purpose of life. Pabanjing-banjing lang, walang direksyon. That is also one of the manifestation of a psychiatric illness. Lack of direction and productivity. So, cheated by time. Hindi naging productive, di ba? So, how come hindi siya productive? Gumising siya kumain, naligo, natulog ulit. O, gumising naman ng umaga, kumain, naligo, natulog ulit. At pabalik-balik lang ginagawa, tapos hindi productive. Sa earnings pa, walang kahit piso na na-earn, di ba? Or walang points. Then has difficulty meeting all needs. Sometimes we manifest this one, di ba? But for a short while lang, di ba? Example, have you noticed or have you experienced that Facebook ba yun? Hindi ko maalala. Basta if you're hooked into some activity just like yung Farmville doon, na naalala ko noon na naglalaro ko ng farm town from early in the morning hanggang gumabi. Nandun pa rin ako sa kinalalagyan ko na naglalaro ng farm town. And that is now a manifestation that you are not already balanced. Okay. Just like now, have you noticed, children nowadays are hooked with computers, di ba? And they doesn't want to be disturbed, especially if they're doing their games. And that is also a problem. So, most of our children now are isolated. They are isolated. They are loner. Kasi they does not participate socially. They does not interact with other people. They only interact through games and the computer, which is very much a manifestation of an isolated person. An isolated person will lead up to mental illness. So we have also has difficulty in meeting own needs. We're done with that. Hindi ka na naliligo kasi naglalaro ka pa rin and all. Dependent to others as to thoughts and action. What do you mean by that? Dependent. Hindi ka makagalaw, wala kang utak. Hindi naman. Wala kang idea kung anong pwede mong anong susunod mong gagawin. So, dependent ka lang kung anong instruct sa'yo, yun ang ginagawa mo. So, para ka na rin robot, di ba? So, you are very much dependent to others as to us to thoughts and action. Sabihin na, ano ko, I hate that person. Yan, bakit? Sabihin mo naman na, manghaon ta, kain tayo. Sabi, sige, kain tayo. Anong kakainin natin? Ikaw, anong kakainin? Sabihin mo, anong kakainin natin? Sabihin niya, ikaw, anong kakainin natin? So, parang robot. So, di ba? Kakainta. Dapat may sarili, may contribution din siya sa conversation. Hindi lang siya accept ng accept. Dapat din, may dapat balance yung pag-send ng information and then receive, then respond, then send again, something like that. Pero ang problema is palagi ka nagsisend, yung response naman ng tao is, ganon. O sige, anong gagawin natin? O parang ganon. Ikaw na lang ang palaging nire-rely niya, di ba? O ikaw na lang palaging nagde-decide. Okay. So, which is now your problem? Feels out of control with self and environment. So that is a problem with your patient with increased anxiety level. Has negative perception. That is when they hallucinate or they have this, they are delusional. Sabi nila may gagawin yung tao sa akin. Or are you like that? Sabi nila, uy, giniba ko ninyo, no? Or you are having negative perception. Okay lang siya pag seldom. What do you mean by seldom? Occasional. Or hindi naman siya palagi, parate pala. So, has ineffective coping mechanism. So, in ineffective coping mechanism. So, all people has so your coping mechanism. It is an effort to decrease stress response. So we have the types constructive or destructive, task-oriented or defense-oriented. When you say coping mechanism, for example, when it comes to a death of a loved one, So, ang death of a loved one, matayin mong bana, or matayin mo ang asawa, simbakoy palayo. So, if they died, there's a tendency that because it is considered a loss, di ba? It is considered a loss. There's a tendency that you will be having this what we call denial, di ba? You cannot accept the fact that you are already a widow. You cannot accept the fact that you lost your husband. Ngayon pa jud ka nga, di ba? Sa cemetery man ka, manim kong gibyan, uban ko, di ba? Oh, that is a very stressful event in your life. So you are going to need what we call this one, coping mechanism. Kaya kung hindi ka makakope, have you noticed those people that who are wearing black, or who happens to be a widow and then they are wearing black? For the whole year round, or 2 years and 3 years na, nag-black lang gihapon. So, meaning, their coping mechanism is questionable. They are still on the process of mourning, di ba? So, coping mechanism is we have either constructive or destructive, task-oriented, or defense-oriented. When you say constructive in a sense that you are going to, in case of loss of a loved one, constructive in a sense that you will not live with the idea that you lost your wife, diba? Maybe you lost your wife and then you have already accepted it and then start to go out, diba? You go out. Kung mabuta na nga ang lalaki, maminyo, tigulang na, maminyo balik. Because that is your constructive coping mechanism. He is doing that for his own good. Diba? So, next is your destructive coping mechanism. When you say destructive coping mechanism, you lost your loved one, and then you keep going to the bar, you keep going to the, what we call then, hubo-hubo, and then you keep on drinking lots of alcohol, and when you got home, you sleep, and you wake up again, work, and then after that, at the end of your work, you go to the bar again and drink, and then routine na siya, then that is destructive because it will do no good to you, diba? It will do no good to anybody. Drinking alcoholic beverages all the time doesn't bring any good to anyone. Oh, you remember that. Task-oriented or you're defense-oriented. When you say task-oriented, you have a goal. You're coping because you have a goal that you're going to finish. You're coping, for example, let's say, uh, let's say, you became pregnant. Nabuntis ka po. And then when you became pregnant, you don't have any man in your life. Wala kang lalaki sa buhay mo. Buntis ka lang. When you say task-oriented, so pinanindigan mo yung anak mo, ginawa mo mabuti. Ay, sorry, hindi ako masyado mag-Tagalog. Ginawa mo yung lahat para maitaguyod yung anak mo. Just starting from infancy down to high school life, the child as in grow normally. Walang hassle. Wala siyang idea na wala siyang tatay, di ba? Because you are doing your job as a mother. You are doing your job, you're having that coping mechanism to do your job well so as to raise your child well also. While you're defense-oriented, because you know when you became pregnant, nang nabuntis ka, walang tatay, and yet you're living with that idea na nabuntisan ka lang. And as in every day in your life, you're going to scold your kid. And every day in your life, you make the kid's life miserable by always shouting, and then the child doesn't feel any love from you, and you even went to vices, and pinabayaan mo yung anak mo, naging drop out pa. That is your defense-oriented, diba? That is your destructive defense-oriented. Kasi sabi mo, ganito lang kami hanggang sa kasi wala kami gawa, kasi wala akong asawa, walang nagsuporta sa akin. So, you're defense-oriented. Okay. Destructive coping mechanism often results to mental health disorder because the person avoids the problem that causes the disorder. So, one thing you have to remember in coping mechanism, you have to face the problem. Okay, you have to face the problem and do not hide from the fact that you have that problem. You have to solve the problem yourself. Okay, so we have installing. Wala. Okay, so we have defense mechanism. Is a coping mechanism of the ego that attempts to protect the individual from feelings of inadequacy and worthlessness, thus preventing awareness of anxiety. The goal here is to decrease level of anxiety when it is too painful, diba? So this is a defense. So you're going to block the idea that you have this what we call anxiety. So as what I've said, coping mechanism. So we have here three personalities. We have the ego, the superego, and then the id. Remember, the ego is at the center. Baliktad yung pagkasabi ko. The ego is at the center. The ego is guided by your superego, but also disturbed by your id or your own self. Okay, the selfish self is the id. So when you're going to have a defense mechanism, it's either the superego will be guided, will guide the ego, or ego will going to listen to the id. Wherein either, as what I've said, you may have the constructive defense mechanism or coping mechanism or your destructive, di ba? Coping mechanism. So management for this is anyways, these defense mechanisms are used to prevent you from feeling ini ka na bitang worthless. You don't feel that you're that important. You feel that you have done something wrong. Okay. For example, if the situation is death, so you felt that you are the death of the parent, you will feel that the amount of care that you have given to your parent is inadequate. That is why you feel that you did not help your client or your parent. So that is feeling of inadequacy. So if that person felt that way, there's a tendency that he will suffer from psychiatric illness. That is why your defense mechanism as a coping mechanism is there for a certain period, so as just to maintain balance in your life, and so that you would not end up to being a psychiatric patient. Okay, management. So management of patient with defense mechanism will assist the client to identify anxiety. Okay, and of course, you have to assist the client to identify anxiety and make sure that you have to facilitate the use of the defense mechanism. Remember, your defense mechanism should not be done consistently. It should be done only occasionally. Hindi pwedeng puro defense mechanism ka lang. Just like, for example, I don't want to study because it's pandemic. That's an excuse. And that is a defense mechanism. You did not make good in school because it's pandemic. That's an excuse also. You're using a defense mechanism. Remember that. For example, you do have low grade because it's a pandemic. So that's an excuse. So that's an excuse. Okay. Even you don't look good, you have lots of pimples. Instead, you will say, because it's pandemic, I can't go to the salon, or I can't go to the spa or something, diba? So there's a defense mechanism. Because without them, you could still do good with your face or your personal, what do you call this? Personal care. Sometimes I got some strange words in my mouth. For personal care. So you could still do things to maintain personal care, diba? Even without the spa and all. I never cut my hair because it's a pandemic. The salon is not there. No, you can cut your hair. How? By letting someone hold the scissors for you, diba? And then cut your hair. Anyways, so avoid this. And during this moment, when the person have defense or using defense mechanism, you avoid criticizing the client's behavior. What do you mean by how are you going to criticize? For example, if the child is angry and you're going to slam the door, what will you say? You will say, you should not do that. That's not good. That's a defense mechanism that he is using. But what you should do is you have to understand the child's actuation and even guide him. You tell him that you should not slam the door when you're angry. You should tell your mother. Right? Okay. So that is how to cope with your defense mechanism. You have to establish an open communication between your child, diba? So that the child would know that it is, he knows that it is very much bad, but he cannot control his anger. That is why he's doing that. And he is using that defense mechanism. Okay. So do not even criticize. And assist the client to explore methods to reduce anxiety. So, how would you do that? So, you could offer, what do you want, pwede rin bribery, no? What do you want to eat? You go out and I'm going to cook something for you, something like that. So, that is to reduce the anxiety felt by the child. Assess the client to use a defense mechanism properly. Okay, so you will tell your child, just for example, if your child shouted at you, then you tell your child, no, you should not shout to mommy. You should say, na let me say this. If, for example, the child were going to say a word, for example, no, dili, you would ask the child that you may say no, but you have to tag along the word mommy. No, mommy. Oh. So that it would be, he is using a defense mechanism, and yet he is on that low tone of voice. Okay, types of defense mechanism. One is compensation. Compensation is putting forth extra effort to achieve in areas where one has real balik-balik siya. Where one has real or imagined deficiency. Na-repeat na ko pag-type, ha? Where one has real or imagined deficiency. Example nito is, for example, pinagalitan mo yung anak mo. O, di ba? Pag pinagalitan mo yung anak mo, is nagalit ka sa kanya. And then after that, your son is crying. Then what you did next is to compensate your wrongdoing or your wrong action, you were going to buy ice cream for your child. That is your compensation. Diba? That is your compensation. Or for example, yung anak mo, babae, nagalit sa'yo kasi may gusto siya, then hindi mo binili. Kasi sabi mo, ang mahal. Kaya hindi mo binili. Pero nang nagalit yung anak mo, pinagalitan mo ng pinagalitan dahil sabihin mo na, anong takala mo sa akin, pinupulot ko yung pera sa kalsada, something like that. So, nakapagsalita ka na hindi maganda sa kanya. And yet, compensation, binili mo yung item na gusto niya at isa pa, yung mas mahal na item pa yung binili mo. So, that is your compensation. Okay. So, next, number 2 is conversion. The expression of emotional conflicts through physical symptoms. Defense mechanism, conversion. Example, during an exam, when you're about to take an exam, what would you feel? Naiihi ka po, or you feel like urinating, or you feel like defecating, or even worse, sumasakit yung tiyan mo. Diba? That is your conversion. And then next is your denial. Disowning consciously intolerable thoughts and impulses. Denial, for example, if you are diagnosed of cancer, it's normal to manifest defense mechanism. So, you're diagnosed of cancer. Sabi ng doktor, you have only 4 months to live. Or 4 to 6 to 1 year to live na lang. Kasi, bakit alam ng doktor yun? Alam kasi ng doktor yung movement ng cancer cells. Kasi may study dun eh. Ganito, ilang araw, ganito yung graph niya. And then 1 month, ganito ang graph niya. So, multiply lang niya yun. So, pag multiply na yun, so makita niya na nakakanat na siya sa buong katawan mo. So, that is one. And so, nag-denial ka na. How would you manifest denial? You seek for the second opinion, the third opinion, the fourth opinion, pwede kayo napunta kayo sa homeopathic medicine and all sorts. So meaning, you are denying the fact that you are diagnosed of cancer. You are denying the fact that you're diagnosed of cancer. And number 4 is your displacement. Displacement is feelings to one person of one person. I guess this one is of one person. Feelings to one person is directed to another who is less threatening, thereby satisfying an impulse with a substitute object. Displacement is the sense when you are angry with your mother or your father, you're going to slam the door. Or let's say you're going to kick the cabinet. That's your displacement. Remember that. You're angry at one person, and yet you cannot hurt that person. So what will you do? You're going to bang the door or bang the cabinet. And number 5 is dissociation. The blocking off of an anxiety-provoking event or period of time from the conscious mind. Dissociation meaning you cannot remember anything about it. Diba? Sabi mo, I forgot. Oh, because you're trying to block the information out from your consciousness. So, as if you appear normal. Walang nangyari. Paano yung sa away ng mga asawa? Just for example, you're angry with your husband or because you're angry with your husband, you tell things to him that are not usual. Not usual, so unusual siya, di ba? Or you tell him things based on your angriness. And your husband is hurt. And yet, he manifests dissociation. As if early in the morning, he just woke up and as if nothing happens. That is also dissociation. That is a defense mechanism. Defense mechanism po yun. Pero normally, ang mga babae, magagalit pa ganun. Diba? Magagalit mas, magiging mas magagalit pala. Number 6 is fantasy. Gratification by imaginary achievements and wishful thinking. O, di ba? Yung mag-fantasize ka na as in, fantasize ka na ikaw yung artista yon, mag-fantasize ka na bahay mo yon, or you imagine as if, for example, real scenario ha, yung ulam nyo ay dried fish, and yet sabihin mo, sige, i-open mo na yung pack ng lechon. Diba? That is fantasize. Oh, imagination. Kahit hindi naman totoo. Number 7 is identification. This is an unconscious attempt to change oneself to resemble an admired person and impulses. So, unconscious attempt ay to identify. So, pag gaya-gaya po tumaya, ginagaya mo ang sarili mo sa isang tao na hindi naman ikaw. Oh, di ba? Just like for example, that person buy or bought mga expensive things. And then you want to convince yourself that you can buy also those expensive things. So you bought it again. You bought things like that, but not that expensive. Because why? You want to be identified that you can or you are that same person, huh? That you wanted to be identified for. For example, book ni Demi Moore. Di kayo yung Demi Moore? Sure, it is a Demi Moore. So Ghost, hindi mo na maalala yun kasi bata pa kayo. Ako, maalala ko pa yun kasi 47 years old na po ako. So, you want to be identified as that. Example, you wanted to be identified like Bella Alonso. O, di ba? So, gusto mo mapapayat kasi gusto mo baya-bayahan, di ba? Baya-bayahan. Or, let's say, Julia Barreto. O, gusto mong maging payat. Tapos, imagine mo yung asawa mo naging si Gerard Anderson. That is your identification. Next is fixation. Never advancing to the next level of emotional development and organization. The persistence in later life of interest and behavior patterns is appropriate to an earlier age, ha? Typographical error po yan. Fixation. So, you never advance. You are fixated. Example of fixation is, excuse me. Example of fixation is thumb sucking. Thumb sucking among children are oral fixation, meaning you are manifesting fixation because of your anxiety. Oh, diba yung mga bata orally fixated sila pag example, iniwan sila ng nanay nila, that's oral fixation. And or let's say fixation still, for example, during anxiety level, you're going to chew a gum. Diba? Hindi mo ba chew a gum? Kakain ka ng juicy fruit. Diba? That is also oral fixation. Especially if you are under stress or if you're under stress. So next is example of fixation. Pag pinagalitan mo yung bata, umihi po siya sa bed. That's also fixation. Similar to your regression. Nag-regress po siya. Number 9 is insulation. Withdrawing into passivity and becoming inaccessible so as to avoid further threatening situation. So passivity, withdrawing into passivity. What do you mean by that? So, ayaw mo na maging passive. But, ayaw mo ding gumawa ng mga bagay that will lead to improvement. So, what will you do? You insulate yourself. You insulate yourself. And the next is intellectualization, or sabi sa pa retobada, or rason jud. So excessive, your intellectualization in excessive use of mental reasoning, that is your intellectualization. Or sabi sa pa, murason, dili mo papildi, or yawitan, that is your intellectualization. Especially if they are about to be what you call it, kumapit na mapildi, they will really reason out. That is your intellectualization. Number 11, introjection, a type of identification in which the individual incorporates the traits or values of another into self. This time, introjection means, wala, mura jud kag ako. Diba? Meaning, you are convincing yourself that you are similar or pareha mo ang nga tao, and yet that person doesn't want to be identified as you. Ikaw lang. Example, meron siya nga, nainganig ko masukol, pareha ta, mura jud ako ikaw. Diba? Because you like that person. Number 12 is isolation, response in which a person blocks feelings associated with an unpleasant experience. Isolation, you will not go out. You're going to stay in one room for time, especially when you're angry with your mother or your father. Ayaw mong lumabas, or you lock yourself in the room. That is your isolation. Number 13 is projection, transferring one's internal feelings, thoughts, and unacceptable ideas and traits to someone else. Projection meaning, pareho pa niya siya sa projection when you're angry at one person, you're going to be angry at another. Example, pag nag-away kayo ng asawa nyo, dahil nag-away kayo, tapos ang ginawa ng husband nyo, pinagalitan niya yung anak niya, yung mga anak nyo. Because he knows that if you will be scolding your children, you will be angry or you will be sad, diba? That is your projection. Manang ka pa minute, away niya na-appeal naman ni. Because your father or your mother is manifesting defense mechanism, projection, diba? Next, number 14 is rationalization, an attempt to make unacceptable feelings and behavior acceptable by justifying the behavior. Or here's your rationalization. You justify the behavior, just like, that is very much common manifestation of one of my sakop. Especially if I'm going to ask them na, ngano maingon ani ni, ngano nabali ang tanong, nakuha na sa iro, nasagian. That is your justification. Or rationalization or your justification. Kahit naman hindi aso yung gumawa, alam na hindi ako magagalit sa aso. So, ang aso palagi ang may gawa ng lahat. Diba? That is your rationalization. Number 15, reaction formation. Developing conscious attitudes and behaviors and acting out behaviors opposite to what one really feels. Okay. If you're sad, then you are that lonely, you are that sad, and yet you laugh out loud. Diba? Tumatawa ka na malakas. That is your reaction formation. Number 16 is regression. Returning to an earlier developmental stage to express an impulse to deal with reality. That is your regression. Examples, what I've said, thumb sucking is a form of regression. Another is, for example, yung voiding in the mat or your enuresis by your school-age child is a form of regression. Because he is angry with their mother, or he is because he was being scolded by her mother, he voids on the mat. Diba? That is also regression. Wala pong mabata-bata na ayaw ba? That is also regression. Magpa-OA. Charot. Okay. Number 17 is repression. An unconscious process in which the client blocks undesirable and unacceptable thoughts from conscious expression. Repression yung real scenario or real situation are hidden or real real scenario nga are hidden from the others, or he just kept that information from others. That is repression. So the client blocked undesirable and unacceptable thoughts from conscious expression. Just like, for example, that is this repression is usually manifested by people or women who suffers from rape. Kasi nagre-repress sila. Hindi nila pinalabas yung totoong information o yung may kinakat-cut sila na information. Kasi naman, kung ikaw ba naman ma-rape, sabihin mo, ano ba? Gigising nila kung sanina, something like that, and that is very much painful for you. That's why you're going to repress the thoughts of it, diba? Or, gibon niya akong panty, that is very much painful for you. That is why you're going to hide the information from that. That is also why being raped is very much painful, and it is very also, you have to understand the person, diba? You have to understand the person na kung bakit hindi malabas-labas ng totoong scenario ng rape. Number 18 is sublimation. This is replacement of an acceptable need, attitude, or emotion with one more socially acceptable. Replacement of an acceptable need, attitude, or emotion with one or more socially acceptable. Example, if you're angry and then what about it? You are going to go out, or let's say go with your friends because you are angry. That is your sublimation. Number 19 is substitution, the replacement of a valid and acceptable object with an object that is more acceptable to the ego. That is your substitute. How? Your substitution is most likely used by parents. Just like, for example, your children ask for that expensive toy, and you're going to substitute it with still a car, but of a lower value. Diba? So, para hindi masyadong mahal, and that is very much expensive. Sayang yung pera. Number 20 is your suppression, the conscious, deliberate forgetting of unacceptable, painful thoughts, ideas, or feelings. This is pare-pareho lang siya ng repression, suppress. This time naman, hindi mo talaga pinalabas. Yung repress, alam mo yung idea, pero hindi mo nilabas. Ito, yung idea mismo is ayaw lumabas doon sa utak mo, or hindi mo ma-express. Number 21 is symbolization. The conscious use of an idea or object to represent another actual event or object. Many times the meaning is not clear because the symbol may be representative of something unconscious. Symbolization, for example, bringing flowers to your loved one, diba? Or yung for example, you like that lady, so you're going to buy flowers for her, or chocolates for her every Valentine's Day, diba? Or not necessarily Valentine's Day, but on an ordinary day. That is your symbolization, because the flower will going to symbolize your love, your love for that particular person. And number 22 is undoing. Undoing is engaging in behavior that is considered to be opposite previous unacceptable behavior through thought or feeling. Undoing meaning you did not do your, what we call this one, you did not do your responsibility as a father, so you buy things for your child. That's your undoing. Techniques used in communication, one is therapeutic, so we have done this one, and the other one is non-therapeutic. When you say therapeutic, it is good for your client with a goal directed within a professional framework that requires appropriateness, simplified efficiency, and your flexibility plus your feedback. While non-therapeutic, it is not good for your client. Goals of therapeutic communication, one is establish a good client and caregiver relationship, of course. Kasi pag non-therapeutic, you are blocking the information or you're blocking the conversation. While you're therapeutic, you're going to establish it. Identify the most important concerns at the particular moment. And facilitate client's expression of emotions. You just allow the patient to express herself. Pag iyak siya, paiyakin mo. Then just allow it. Then we have recognize client's needs and identify client's perception of a given problem. Oh, that is sure how you're going to handle. Next, therapeutic communication. One is offering what? Offering self. So how would you going to offer self? Making self available and showing interest and concern to showing interest and concern. Just for example, if the child, you know that the child, not the child, that you saw the elderly as if standing and then looking at nowhere, diba? Just staring at the, what do you call this one? Staring at the staring on the air. So what will you do? You just tell him hi. Do you mind to walk with me? Or I will walk with you? Something like that. That is your offering self. Or just sit beside the person, diba? Or stand beside the person. That is also offering self. Okay, next. So, offering self, not necessarily as you're going to give your body to the person. Sabi ni ma'am, offering self, so I'm going to seduce my client. No. Offering self is just making available for a talk or for a walk. Number 2, active listening. Paying close attention to what the patient is saying by observing both verbal and non-verbal cues. So, active from the word active listening. Maintaining eye contact and making verbal remarks to clarify and encourage further communication. So that is your active listening. Number 3 is exploring. So you're going to allow your patient to explore. So for example, if he's talking about his son, you will ask him, okay, you may go on and tell me more about your son. Okay, and just like that. Number 4 is giving broad openings. What do you want to talk about today? So they should broad, diba? That because you're going to give the person a chance to identify the points that he wanted to talk about. Okay, that is show off himself. Number 5 is silence. Silence is a planned absence of verbal remarks to allow patient and carer to think over what is being discussed and to say more. Diba? Silence is you are allowing the person to think. Diba? Okay. Number 6, stating the observed. Oh, for example, ang patient namugot. So, bigyan ka nga, you look sad today. Oh, diba? So, verbalizing what is observed is that the patient, in the patient for validation and encourage discussion. Okay, you sound angry. Or mura makagisapot. Or something like that. Stating the observed. Number 7, encouraging comparison, asking to describe similarities and differences among feelings, behaviors, and events. Can you tell me more? So you were going to say nga, can you tell me what makes you more comfortable working by yourself or working as a member of a team? So you have to give option. So encouraging comparison. Next is identifying themes. Asking to identify recurring thoughts, feelings, and behaviors. So example of this, when do you always feel the need to check the locks and the doors? That is your identifying themes. So say, meron siya nga, kuan man, ay ka nang mahadlok kung daan mo sa kadiri mo, nang mahadlok ko ba? So, because of the fear, you're going to lock the door. So, what will you do? You ask him na, when do you always feel the need to check the locks or door? So, kung saan mo ma-feel ang need nga mo check sa locks or door? Number 9, summarizing, reviewing the main points of discussion and making appropriate conclusion. That you're summarizing, just like what you did in the exam. During this meeting, we discuss about what you will do when you feel the urge to hurt yourself again, and this include blah, blah, blah. Number 10, placing the event in time or sequence. Asking for relationship among events. So, when do you begin to experience the tics before or end or after your grade school? O, diba? Kamusta ka na sugod ana? That is your placing the event in time or sequence. Voicing doubts. Wala pala siyang, we, sure ka? O, that's your voicing uncertainty about the reality of patient statement. Then you have, and then your, what could it be? I cannot see. And conclusions. So, I find it hard to believe, di ba? Sabi ka, sure ka. So, nambala, mag-man siya, we, sure? No, that's I find it hard to believe. That is your voicing doubt. And then next, we have encouraging description of perceptions. Asking the patient to describe feelings, perceptions, and views of their situation. What are these voices still telling you? For example, I heard voices. What will you do? How will you respond? What are these voices telling you? Then presenting reality or confronting. Stating what is real and what is not without arguing with the patient. Example, I know you hear this voice, but I do not hear them. I am Grace, your caregiver, and this is the hospital and not a beach. Okay, di ba? Example, kato maghubo na maglikulaw ka maligo beach, di ba? Excuse. And then seeking clarification, asking patient to restate, elaborate, or give examples or ideas of feelings to seek clarification of what is unclear. Example, I'm not familiar with your work. Can you describe it further for me? So that's your seeking clarification. I don't think I understand what you're saying. Okay, that's your seeking clarification. Number 15, verbalizing the implied. So, kung anong sinabi niya, i-verbalize yun or repeat mo na because you're going to check your listening skills also. Then you're facing patient's words to highlight an underlying message to clarify things. And then a patient, I won't be bothering you any more soon. And the caregiver said, are you thinking of killing yourself? O, diba? Then, next is your reflecting. Reflecting na tayo. So, throwing back the patient's statement in a form of question helps the patient identify feelings. Patient, I think I should leave now. Caregiver said, do you think you should leave now? Oh, that is also reflecting. And then 17 is restating, repeating the exact of words of patients to remind them of what they said and to let them know they are heard. So we should restate it. Example to this is your patient. I can't sleep. I stay awake all night. But how would you respond? You can't sleep at night. O, diba? That is your restating. The same lang sinabi ng client yun. Then, number 18 is general. You have to using neutral expression to encourage patients to continue talking. Example, go on. Okay, proceed, Decibel. And then, 19, asking question. Using open-ended questions to achieve relevance and depth in discussion. How do you feel when the doctor told you that you are ready for discharge? So that is your okay, next is reflecting. Reflecting is from the word reflection, diba? Throwing back the patient's statement in a form of question that helps the patient identify the feeling. Example, patient, I think I should leave now. Then the caregiver will going to respond, do you think you should leave now? O, diba? Number 17 is restating. So you restate, just like reflect. Kung sa question, ang reflecting is question, this time, imo gyapon siyang ibalik. So, pare-pareha ra siya. Repeating the exact words, di ba? Repeating the exact words to remind them of what they said and to let them know they are heard. Example, I can't sleep. I stay awake all night. So, what will you do as the caregiver? You can't sleep at night, di ba? That is your restating. You just restate the words or even you restate the words but with the same thought. Number 18 is general. Using neutral expression to encourage patients to continue talking. Example, go on, as you were saying, or something like that. Next is asking questions. Using open-ended questions to achieve relevance and depth in discussion. So example is, how did you feel when the doctor told you that you're ready for discharge? That you're asking questions. Number 20 is empathy, or putting yourself on the patient's shoes or other shoes. Recognizing and acknowledging patient's feelings, it's hard to begin to live alone when you have been married for more than 30 years. This is in the case of when the spouse or the husband died. That is your empathy. Number 21, focusing, pursuing a topic until its meaning or importance is clear. Let us talk more about your best friend in college. How would you, then another thing is, as you were saying, that is your focusing. Then number 22, interpreting, providing a view of the meaning or importance of something. Patient, I always take this towel wherever I go. The caregiver will then say, that towel must always be with you. Diba? As per interpretation. So, observation. So, or as you have observed it. Number 23, encouraging evaluation, asking the patient's views of the meaning or importance of something. What do you think led the court to commit you here? So, something like that. Encouraging, then you're going to evaluate. Can you tell me the reasons you don't want to be discharged? Can you tell me the reason why you don't want to be discharged? That is your encouraging evaluation. Number 24, suggesting collaboration, offering to help patients solve problems. How would you respond? Perhaps you can discuss this with your children, or so they will know how you feel and what you want. That is your suggesting collaboration. Right. Okay, especially if there is conflict within the parents and then the children or the patient or the mga caregivers, diba? Sometimes you would notice that the patient or the client always replace the caregiver. So who is now the defective person there? Is the caregiver or the client? So maybe the client. So you have to restate also the idea and suggest collaboration. So in my case, I always tell them na maybe your mother doesn't want to be taken care by other people. She wanted to be taken care by you, something like that. 25, encouraging goal setting, asking patient to decide on the type of change needed. What do you think about the things you have to change? What do you think about the things you have to change in yourself? That's your encouraging goal setting. So you have to let the patient decide. Number 26, encouraging formulation of plan of action. Probing for step-by-step action that will be needed. If you decide to leave home when your husband beat you again, what will you do next? Yung na po ng asawa na, madagan na po ko sa DSWD. Pero balik ka po sa bana, mga tala, di ba, mga abnormal. So 27, encouraging decision, asking patient to make a choice among options. Given all these choices, what would you prefer to do? So you set the choices. But still, you want him or you let him decide. Number 28, encouraging consideration of option, asking patient to consider the pros and cons of possible options. Have you thought of the possible effects of your decision to you and your family? That is one. So this is your consideration of option. Encouraging consideration of option. Especially is the option A is very much tangly ba? O tangly or medyo siya defective. So you have to encourage consideration of option. Number 29, giving information is providing information that will help patients make better choices. Nobody deserves to be beaten, and there are people who can help and places to go when you do not feel safe at home. That is your giving information. Number 37, wala siya kabalon na ada siya DSWD, di ba doon ra? So you have to give the information, especially kung battered siya. Number 30 is limit setting, discouraging non-productive feelings and behaviors, encouraging productive ones. So what will you do? Please stop now. If you don't, I will ask you to leave the group and then send you to your room. Okay, that is your limit setting. Just take out sa klase, pag noisy na kayo, may mo na may sa di mo mundang namlakaw ko. That's your limit setting. Okay. Number 31, supportive confrontation, So acknowledging the difficulty in changing but pushing for action. So I understand you feel rejected when your children sent you here. But if you look at this way, so for example, in this case, the elderly was sent was sent to the facility, and he is having this bitterness with the idea that he was there. So now the caregiver will say, I understand you feel rejected when your children sent you here, but if you look at this way, it is much better because you could because we met, we have given a chance to talk, and then you could socialize with other elderlies, diba? Number 32 is role playing, practicing behaviors for specific situations. Both the caregiver and patient play a particular role. I'll play as your mother, tell me exactly what you want to say when you meet me on Sunday. For example po, kung uyab nagbulag, so yun ka nga, bulagan ni mo yung uyab. So, kayo na yung uyab, nang uyab, lain, so mingon na ka nga, sige, ingon na yung klase, sige kuno, ako kuno yung uyab, so amo ko yung pagbulag, something like that. That is role playing. Number 33 is rehearsing, asking the patient for for a verbal description of what will be said or done in a particular situation. So there is supposing you meet these people again, how would you tell them? How would you prevent them to no, not how would you prevent them? How would you respond to them when they ask you to join them for a drink? So it is your rehearsing, especially if it is addict or alcoholic. Usually role playing and rehearsing will do the most job. Next is feedback. So pointing out specific behaviors and giving impression of reactions. I see you comb your hair now. That is your feedbacking. Number 35, encouraging evaluation, asking patients to evaluate their actions and their outcomes. What did you feel after participating in the group therapy? Oh, that's your encouraging evaluation. 36, we have reinforcement, giving feedback on positive behavior. Everyone was able to give their option when we have the session one by one, and each of us waited patiently for our turn to speak. That is your reinforcement, diba? Okay, now we're going to proceed with non-therapeutic communication. Number 1 is overloading. Overloading is talking rapidly, changing subjects too often, and asking for more information than can be absorbed at one time. Example, what is your name? I see you like sports. Where do you live? So that is overloading. Okay. Number 2, value judgment. Giving one's own opinion, evaluating, moralizing, and implying one's values by using words such as nice, bad, right, wrong, should, or you shouldn't do that. It's wrong. No, that is your value judgment. Ayaw, wag po yan. Hindi pwede. And then incongruence, or dili magka-tugma. So for example, yung I love you, and then you are looking at another girl. That is incongruence, diba? So sending verbal and non-verbal messages that contradict one. The caregiver tells the patient, I'd like to spend time with you, pero hindi lakaw ang caregiver. Igadagan pa. So that is your incongruence. And underloading, remaining silent and unresponsive, not picking up cues in family, failing to give feedback. The patient asks the caregiver simply, and then the patient asks the caregiver, and it simply walks away. That is your underloading. Then false reassurance or false agreement. Using cliche to reassure client. For example, it's going to be alright. Okay. For example, di mo na siya sakit. That is your false reassurance. Because definitely in operation or during operation, you're going to feel slight pain even if with anesthesia. So you should not tell the patient na dili sakit because it is very much sakit. 6 is invalidation, ignoring or denying another person's thoughts or feelings. Client, how are you? Caregiver respond, I can't talk now, I'm too busy. That is your invalidation. Invalidation po yan. Next is focusing on self, responding in a way that focuses attention to the caregiver instead of the client. This sunshine is good for my roses. I have beautiful roses in the garden. There's your focusing on yourself. Okay, Mingka matulog, sige, we were going to walk to the garden, and you will say, I have I'll have lots of plants. So, hindi make a interview sa patient. You have to be the one to listen to the patient, not the patient listens to you. Number 8, changing the subject. Introducing new topic at one time. Inappropriately, a pattern that may indicate anxiety. The client is crying when the caregiver asks, how many children do you have? That is your changing the subject. Okay. Kasi nga, umiyak siya tapos sabi mo, uy, yan ang hilakay. How many children do you have? So they should changing the subject. Number 9, giving advice. Telling the client what to do. Okay, number 9. We have giving advice, telling the client what to do, giving opinions, or making decisions for the client. The client implies client cannot handle his or her own life decision, and that the caregiver is accepting responsibility. If I were you, or it would be better if you do it this way. Remember, you should not give advice. Remember that. Besides sa mga friends, bulagi siya bulagi. No. Because, di niya bulagan. Kaya nga, no, the more you hate that person, the more she will going to love them. Okay, love him pala. Number 10, internal validation. Making an assumptions about the meaning of someone else's behavior not validated by the other person. That is your jumping into conclusion. So the caregiver sees a suicidal client smiling and tells everyone nga, okay na siya, kay good mood siya. So that is your internal validation.